Hi, this is pharmacist Curtis Alexander. In this video, we're going to talk about Lisinopril. This is part of our 101 series where we're going to take a kind of a 35,000 foot overview of some of these medications and supplements. I'll break down the important points, what you need to know as a consumer so you can talk to your doctor. And then at the end of the video, I'll just give you my big takeaways from the medication. Before we get going, thumbs up if the video was helpful. Also subscribe if you want to see more videos like this on medications and supplements from a pharmacist perspective. So getting into it, Lisinopril is primarily used to treat hypertension, or more commonly referred to as high blood pressure. Now, it's in a class of drugs. The MOA is a mechanism of action. It's in a class of drugs called ACE inhibitors or ACE blockers, and ACE stands for Angiotensin Converting Enzyme. Real fancy way of saying that there's an enzyme it blocks, and that eventually leads to vasodilation. It also can increase and does increase the amount of renin and decreases the amount of what's called aldosterone. The end result of that is, with that vasodilation, the renin going up, aldosterone going down, is you get a decrease in blood pressure. Now, as far as side effects go, this class of drugs, but Lisinopril in particular, is pretty well tolerated. The primary side effect you're going to see, and this is the case with a lot of blood pressure medications, is obviously the blood pressure can go too low in some cases. Now, your doctor is going to counteract this by starting out with a lower dose and then going up from there. But 4 to 11% of people can see low blood pressure. And the next thing is dizziness. 4 to 19%. It varies based off which study you're looking at. But again, as the blood pressure goes too low, people can get dizzy. So do be careful. Your first few doses when you're standing up, that sort of thing. We can see an increase in serum creatinine. This, I mention it because it can happen, but it tends to not last, tends to be transient, tends to go away. Increase in BUN, which is basically another lab measurement, for lack of a better term. It's not very common, 2% of folks. Again, doesn't stick around very long, tends to be transient. Now, the side effect that I wanted to spend some time on, it's not really common, but when it happens, you tend to have people stop taking the medication, and that's a cough. Again, it only happens in about 3 to 4% of people who take it, but it tends to show up as a dry hacking. It's not a productive cough, not something you're coughing up, it's just an annoying cough. And again, doesn't happen in a lot of people, but when it does, it tends to stop people from taking it, and it doesn't tend to go away if you stay on the medication. It usually will show up. People will say it's, the first couple weeks they'll notice, and then this cough pops up. Sometimes switching to another medication in this class can do the trick, but most of the times it's not going to happen. So again, it's a bummer when it does happen for people, but it usually means you're going to have to stop it, try something different. Next thing is, you cannot take it in pregnancy. There's no way around that. In the black population, we tend to see the effectiveness of Lisinopril go down. We also see the cases of what's called angioedema go up. So for the black population, it's not a very ideal, a very effective medication to be going with. The next thing is weight gain and hair loss. I mention this in a lot of the videos because it's a popular question that you get from people when they take medications. Lisinopril is no different. Interestingly, in most cases, people ask about it and it doesn't happen, but with Lisinopril we can see some of these things. And with weight gain, it's not necessarily weight gain that we see, but it can be weight loss. There have been studies where people show weight loss. It's not a huge weight loss, but again, 2 to 3 pounds tends to be mentioned in the studies. Hair loss can happen. Again, it's not common. Less than 1% of people have seen some hair loss. So my thoughts as a pharmacist on lisinopril, it's one of the most popular medications out there based on how many prescriptions are written for it each year. So it's popular. It tends to be well tolerated. There's certain populations where it's not a great choice, but overall it tends to be very popular, well tolerated. The biggest side effect, in my opinion, outside of dizziness or low blood pressure, is you do have to keep an eye on the cough that might develop. Again, if it does, you're probably going to have to switch to a different class. Sometimes you can get away with switching to another drug in the ACE inhibitor class, but often that's not the case. You're probably going to have to go to a different class of drugs. So that's Lisinopril 101. Any comments? I'd love to know if you've taken lisinopril before, what your experiences were, if you know somebody who was on it, what their experiences were. So mention that. Just post that in the comments below. I'll do my best to respond, but I know other viewers would appreciate feedback as well. I hope this video was helpful. And again, pharmacist Curtis Alexander. Until the next video, thanks.